Welcome back to Morning Joe. With a growing number of coronavirus patients flooding hospitals across the country, more and more healthcare workers are now facing off with administrators over a lack of protective gear. As the New York Times points out, many hospitals do not allow doctors and staff members to wear masks in public areas, and now some healthcare workers are being disciplined for pushing back. The Times spoke to a doctor from El Paso, Texas, for example, who was removed from his hospital's schedule, effectively suspending him without pay after he wore a mask in the hallways. The New York Daily News interviewed nurses and doctors at the Jacobi Medical Center in the Bronx who say they feel like they're on a suicide mission due to a lack of personal protective equipment. One healthcare worker telling the paper, quote, "We just had a nurse who passed away over the weekend from this. We are starting to see our own fall sick. Who is going to replace us?" And now some hospitals reportedly are threatening to fire healthcare workers who speak out about a lack of protective gear. For instance, Bloomberg reports that NYU Langone Health System has warned employees they could lose their jobs if they speak to the media without authorization. Joining us now, President of the American Medical Association, Dr. Patrice Harris. Dr. Harris, thank you for being with us. I'll start at the end of that bit of news for you. What would you say to a hospital who has told its doctors, its nurses, that they should not speak out publicly about what's happening inside these ICUs and these ERs?
Well, good morning, Willie. You know, every moment, every hour, every day, physicians and nurses and other health professionals are risking their lives on the front lines. And for weeks, we've all heard the stories that they don't have the PPE, that personal protective equipment that they need. And now we hear these stories. Actually, I just spoke with a colleague last night of physicians being fired for wearing masks in the hallway or even using their own equipment. That is unconscionable, and the AMA has clearly stated that physicians should not be disciplined for either speaking to the media or wearing their own equipment. Listen, we all know that there could be reasonable policies to coordinate media, but physicians are just telling us what we already know in the public, and so that behavior in firing physicians is unconscionable.
And we know about the lack of personal protective equipment in large part because we are hearing from doctors publicly. A lot of us are hearing from them privately, and we're able to convey their stories to the public so that the government knows what's needed here. So let's go to personal protective equipment. We know the need is there. I've been hearing from some doctors in New York, and Governor Cuomo made this point a couple of days ago, that the situation is getting better, that they're getting some of that PPE that they need, but that it's inconsistent. One day it seems like it's been stabilized. The next day they're out again and they're waiting. So how is it from where you sit on a national level, looking at all these hospitals and listening to your doctors and nurses, how is the supply chain working, and is that situation getting better with personal protective equipment?
Well, in some areas it's better, and in other areas it's not. That's that variability that really we really need to do something about. As you may know, the AMA called on the president to have a tracking system for the testing for equipment so that there could be data and evidence to show areas of the country that need the PPE, need the ventilators, need the test. And prioritize those areas. So we really need to have a Manhattan effort type project to bring everyone in the room and make sure there's tracking of these supplies. The area that needs it today or doesn't need it today may need it tomorrow. But if we figure out that tomorrow, it's already too late. And so we really, again, need the DPA to be in full effect so we can make sure tests and supplies are manufactured and distributed in a manner that makes sense. And that's where a national tracking system and a federally coordinated effort comes into play.
Dr. Harris, I know Massachusetts was graduating fourth-year medical students early to try and help sort of infuse the hospital population with doctors. What are you hearing about doctors falling ill? And are we looking at a potential shortage of medical workers?
Well, Mika, you already know that we were at baseline pre-COVID-19 operating with some issues around workforce shortages. And of course, now we are seeing an even greater demand. And of course, medical schools are allowing their students to graduate a little early, of course, granted that they've met certain criteria. Retired physicians are coming back into the workforce to help. So certainly there is increased demand, which is all the more reason to make sure that the current workforce stays safe and stays healthy. And a part of that is making sure we have the tools that we need, the PPE. And so, again, an all-hands-on-deck effort is needed to make sure physicians and nurses don't fall ill. If we do, who will be there to take care of this nation?
All right, Dr. Patrice Harris, thank you very much.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.